the Prime Minister and the Planning Department that we need to double the percentage of GDP. But more important than that is we really need a collective effort from the private sector, the public sector, and the states involved, because healthcare is a state subject. So unless and until we have these partnerships, and the partnership really can go even global. And that is where what I have planned is to have a thinking cap and have a group, call it a task force from the best people in the world. In the next few days, this is what I'm going to have. Sit down and understand what we need to do in India. And like I said, that America spends close to 16% of the GDP, but still healthcare is a huge issue. And as far as the success of NRHM is concerned, it's hugely successful. All we now need to do is ensure that this program reaches not only from village to village, but from household to household. And I must mention out here that I have plans to, come up with what would be known as e-health card, electronic health card. It will not be a physical card, but whoever child is born, whether at the pavement or in the house or in the nursing home or where have you, will get this card. And this card will have all the history of the child, the blood group, the weight, the vaccination program, and what have you. And as the child grows, the entire archive, the history will be there on the card. So any child needing some kind of attention and some kind of guidance from a doctor, let's say in New York, so all the doctor has to do is just punch few buttons and the entire history will be there. So this is another thing, and through the health card, you can also have your educational programs. And ultimately, I think what we are going to see is maybe a small device like a cell phone, and people from the diagnostic industry are going to go to house, and whether it is the sugar, whether it is the blood pressure, whether it is the heart, every data is going to be collected and put it in this small little device which will be transmitted to the archives or to the server and maybe to a diagnostic center. This morning I spoke to one of the largest diagnostic people in the world, which is the Quest. And Mr. Surya Mahapatra is the CEO. I had lunch with him. So we are devising that to go into the villages in India as well. So these are going to be combination of all the efforts. So yes, NRHM is hugely successful program. Please.
My name is Jessica Pickett. I'm a second year in the doctoral program here in the Healthcare Management and Economics Department. I was curious if you could discuss a little bit about the strengths and the weaknesses of the RSBY insurance scheme for the poor, as well as some of the related state-funded insurance schemes.
The insurance scheme?
Yeah, so RSBY, which I understand that the center has proposed and a number of states are taking forward, as well as SAS in Karnataka and Arogashri in Andhra Pradesh. I'm curious what the relationship is between the center and the states in these programs, and then what you see as their long-term potential and how fast they've been able to scale up.
You see, as far as the center is concerned, at the end of each year, every minister from different states, they come on to the center government. They give their program as to what they're going to spend where. And depending on the population and the educational level and the geographical location of that particular state, we give them money. So, and we guide them that, look here, this is where you need to spend more money. You need to spend a little more money on, let's say, malaria eradication program or polio eradication program. So from that point of view, we just guide the state, but we cannot dictate them as to what they should be doing. So unless and until the state comes and tells us that, look here, we require all your help. So we have the manpower, we have the medicine, and when the state comes and tells us, we do as per the need based and not cross our brief. because as I mentioned that this is purely a state subject, and that is why you find difference in the medical parameters if you compare our states in the southern part of the country as compared to the northern, or for that matter the eastern part of the country. Yes.
Yeah, I'm Neeraj, I'm a second year MBA, and thanks for coming here today. It's been a huge privilege for all of us to listen to you. My question is regarding the opportunities for entrepreneurship in India. So is your ministry doing some special efforts to encourage entrepreneurship right now? Are there institutional wires which are too big for people like us to come and start the business?
It's only in the health area or generally speaking?
So I'll talk to you about health, but yeah.
No, I tell you because if there is any country where meltdown has not really affected much, that's India. Because, you know, fortunately two things have happened. Our economy was not based on export, and secondly, our financial institutions were quite conservative. So if somebody needed $100 loan, unless and until they have $200 worth of asset, you wouldn't get $100. As compared to what happened in America, if you had asset worth of $100, you can perhaps take $1 million, I don't know. So, and sometimes they didn't even know what kind of asset you're holding. So these are the two areas where India has been a success story, and the entire Indian economy is consumption oriented. So you to take industry wise, you take civil aviation, and you see number of aircraft. Today, whether it is Airbus or Boeing, when we talk about outsource, the jobs are outsourced here or for that matter in Europe. And we have got so many orders of the new aircrafts. You look at the pharmaceutical industry. We have got now state-of-the-art hospitals at the city level. You look at the communication. You look at the infrastructure. You look at now the nuclear power stations. So you have to decide which area you want to go. The eateries. I think whichever area one wants to go, as long as you have the business acumen, which I'm sure Wharton is going to teach you a lot, you cannot just go wrong in India. That is a happening place. And that is where when Mr. Jain mentioned that now it is the reverse or brain drain, if I may use the word, and that's why people now would like to go back. And whether you believe it or not, the whole process was started by me as early as 77, 78. After going through my training out here at UT Austin, I had the opportunity of getting myself trained in business out here. And then I went back. And there were not great opportunities then. And people thought I was nuts to go back to India. And I'm glad I went back. So you have to be a visionary. And I can tell you, that's the place it's happening. And today if you see the number of rich people in the world, you find a lot of people in India today. And that's what has changed. The whole thinking in the country has changed. It is a renewed energy. And we have some of the fantastic people around. And the world has opened. In fact, people were concerned that what will happen when there is competition. India has been always a country of entrepreneurs, business, right from the days of Silk Route, whether it was business with China, with Europe. India has always been on the forefront of business. So as a matter of fact, the competition in the world has helped India. As long as the world was closed, Indian economy didn't develop. The moment it integrated with the world, Indian economy really shot up. And that's what India is all about. So don't hesitate. After finishing your degree, come on in. Please.
Mr. David, thank you for being here, sharing your thinking. My name is Lauren Myers. I actually work in the healthcare industry, pharmaceutical industry here, both U.S. and global. And we hear that the next emerging market outside of India, of course, China, for us to address patients. But